The news is disturbing, and it's from the front lines of the pandemic. The United States has recorded its single worst daily death toll since the pandemic began. More than 3,100 Americans lost their lives as a result of COVID-19 yesterday alone, and the current death tolls are now above the numbers seen during the peak of the pandemic. That was back in April. That was the worst moment of the outbreak back in the spring. Record high hospitalizations are also pushing medical centers and healthcare workers to their breaking point. Health officials anticipate these numbers will only get worse as the country begins to feel the delayed effects of that Thanksgiving travel. David Begnaud reports on new safety measures being implemented by local officials.
You know, there was a text message alert that went out to people in Los Angeles. It scared a lot of people and confused them because to some it sounded like martial law. Stay in your home and don't come out. Look, the mayor of Los Angeles says this order is going to have some teeth to it. We are going to vigorously enforce it. But you need to know there is a laundry list of exceptions to this order. Watch.
My message couldn't be simpler. It's time to hunker down.
With more Los Angeles residents infected with coronavirus than ever before, Mayor Eric Garcetti issued what's called a targeted safer at home order for everyone in the city, directing them to remain in their homes.
It's time to cancel everything. And if it isn't essential, don't do it.
Now listen, there are tons of exemptions, not only for essential workers, but also for those who need to keep non-essential businesses running, including retail stores and restaurants. Also exempt from the order are faith-based services and protests. Now, the number of Californians hospitalized with COVID-19 hit a record high for the fourth straight day on Wednesday. This is as hospitals around the country are bracing for a surge upon a surge, as it's called, because of holiday gatherings recently.
December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation.
And those concerns have some people pressuring the FDA to move faster on approving a vaccine. But Commissioner Stephen Hahn told CBS News his agency will not cut any corners.
What we're going to do is actually crunch the numbers ourselves, look at safety, look at efficacy, and we're going to do that line by line.
After approval, Operation Warp Speed hopes to have the Pfizer vaccine out the door by December 15th. With doses allocated to states by population. For example, some 300,000 to California, 170,000 to New York, 19,000 to Minnesota, and 12,000 to Maine. Among the first people to get the vaccine are frontline health workers, like Dr. Kurt Poppenfuss. He is the only full-time doctor treating about 900 people in Cheyenne Wells, Colorado. So when he contracted the coronavirus in late October, his hospital had to scramble to replace him.
I'm the clinic doc, I'm the ER doc, and I'm the hospitalist when I'm on call. You know, I do everything.
I get the sense that even though you are recovering and you should be in bed resting, you probably feel a sense of guilt.
Yeah, it's almost like survivor's guilt in a way. I guess it took 5 different doctors to cover me in 1 week. If all your healthcare docs are like me, then what the hell are you going to do?
You know, the doctor was telling us that he feels kind of drunk. He's got a lot of brain fog right now. And he said, David, I'm usually so quick on my feet. And he said, I'm not. So he said, before I go back to work, the state has told me I'm going to have a cognition check, a mental cognition check, to make sure I'm up to speed, so to speak. Lad and Anne-Marie, back to you.
All right, David, thank you. So for more on what we need to know about the coronavirus as it stands right now, let's bring in Dr. Shoshana Ungerleider. She is an internal medicine physician at California Medical Center. Thank you so much for joining us, Doctor. So you heard in David's piece, CDC Director Dr. Robert Redfield has a very dire warning, the expectation, the possibility, 450,000 deaths by February. The real concern is the next few weeks, what he calls the most difficult time in public health history for this country. Tell me what you are concerned about as you look forward to the next few weeks over the Christmas and New Year's holiday and, the next few months.
Well, Anne-Marie, what we're seeing is widespread community spread across the entire country. So this is truly a dire situation that we're in. We're seeing, as you said, new highs in hospitalizations from COVID-19. In much of the country, our hospitals are already completely overwhelmed. We're running out of staff and supplies to take care of people. And as a result, I'm very concerned that care for everyone will suffer, not just for patients with COVID. But more new cases and hospitalizations and deaths from COVID aren't inevitable at this point. There are things that we can all do to change the course here. We need people to cancel their non-essential holiday travel. This is absolutely key at this point. You know, much of the transmission in communities is coming from families and friends who are getting together in small groups and really unknowingly spreading the virus to each other. You know, the end is in sight here. We all need to double down on our efforts right now. We have 2, maybe more, viable vaccine candidates, which will likely be available by the middle or the end of next year to the general public. But we first really have to get through this dark winter, and we need to do it together as a country.
Dr. Ungerleider, as you know, the COVID tracking project stated yesterday that the U.S. surpassed 100,000 coronavirus hospitalizations. That's a record high since the beginning of the pandemic. I want to ask you about the obstacles healthcare workers are facing right now as they try to treat patients.
Well, Vlad, they're significant. We just heard from a doctor who himself became sick and had to take leave. We're seeing that across the country as nurses, as social workers, doctors, and respiratory therapists are putting their lives on the line every single day and becoming sick themselves. You know, what we are finding is that there are shortages again. Like we saw at the beginning of the pandemic, and it was talked about quite a lot, of personal protective equipment, PPE. In much of the country, they have run out of supplies to protect our frontline healthcare workers. People are having to reuse masks and gowns. In America, this is unacceptable. So we really are, frankly, in a dire situation in most of the country. And so we need everybody to step up here and help us out.
You know, you mentioned the COVID vaccine on the horizon, and what we're looking at once one is authorized is it'll be distributed. Initially, just some jurisdictions will really just get a fraction of what they need so that they can deal with some of their frontline healthcare workers. But even, you know, it's a fraction of the healthcare workers that will be covered, just to sort of make things clear. So what needs to be done in order to get the vaccines, you know, quickly into the arms, if you will, of the people that need it the most?
Well, Emery, you know, it takes time to manufacture hundreds of millions of vaccine doses, the required number, you know, for the entire population, right? So we know this is all going to be rolled out in phases. In this first phase of distribution that we expect will be later this month, you know, that will focus on our 20 million healthcare workers, with our frontline healthcare workers being the priority, as well as long-term care facility residents, as well as staff. So this is actually critical so that we can keep our healthcare system functioning. We know states will have some flexibility as to who receives vaccines, but in this first phase, there's going to be really limited supply of doses, and it will ultimately be up to our governors to decide who gets them. I should also point out, to your point, that once the states receive them, these vaccine doses from the federal government, the states themselves are actually responsible for the distribution and the other logistics around administering doses. So this process is not going to be easy, given that vials need to be kept very cold, they need to be stored in a very specific way. Coordinating people who are required to get a first dose and then a second dose. So the logistics around that are significant, and our public health departments are really underfunded and therefore understaffed. So if support for this is only coming from our local and state governments at this point, this is going to be really challenging, and the public will need to be very patient with this process overall.
Doctor, a new Oxford study has identified prisons as a top priority for vaccination. A CDC advisory committee has proposed prioritizing correctional officers and others who work in jails and prisons for the first phase of immunizations. Now, according to documents obtained by the Associated Press, the federal prison system will be among the first government agencies to receive a vaccine, with the initial allotments going to staff and not inmates. How significant, though, is the risk posed for inmates right now? Should they also be prioritized given their living conditions?
Well, Vlad, we know at least 200,000 inmates in the U.S. have already been infected with COVID-19. People in prison are 4 times more likely to be infected than people in the general population. We also know inmates have higher rates of chronic disease, and a disproportionate number of them are people of color. So mortality rates among prisoners are higher than in the general population as well. The reasons are clear, right? Inmates live in crowded spaces. They share facilities where distancing is really impossible, which makes the spread of the virus much, much easier. So public health experts actually believe that outbreaks that start in our prisons may actually spread also to the surrounding community. So from a public health perspective, focusing on incarcerated people is really important. But I think society also has, of course, legal but ethical responsibilities to protect the health of inmates. So this is an important conversation to be having.
All right, Dr. Shoshana Ungerleider, always great to have you, doctor. Thank you so much.
Thank you for having me.